no. Ooh, oh, And anything, the news came down, a whisper turning through our land. Hearts were shaking, fear was loud, but we stood strong, we made our vow now. 36,000 stories live, mothers, daughters fighting still, women carrying heavy loads. Time to lift them, heal their roads. No more silence, no more shame. Call your brother, speak your name. We can end it if we stand hand in hand across the land. No more silence, no more shame. Call your brother, speak your name. We can end it if we stand hand in hand across the land. Wake up, Liberia, we stronger than before. Overcome disruption, we go open every door. Know your status, save a life. Together we transform. Hope is rising like the sunrise after every storm. Wake up, Liberia. Oh, wake up. Wake up, Liberia. Oh, wake up now. Oh, wake up, Liberia. Oh, wake up. Oh, wake up, Liberia. For the fight, education bring the light. Testing free, the truth must grow. Knowledge strong like river flow. Doctors, nurses on the ground, heroes working all around. This our moment, this our time. Break the stigma, break the line. Yeah. No more whisper in the dark. We light candles, spark by spark. Treatment work, so don't delay. Hope alive in every day. No more whisper in the dark. We light candles, spark by spark. Treatment work, so don't delay. Hope alive in every day. Wake up, Liberia, we stronger than before. Overcome disruption, we go open every door. Know your status, save a life. Together we transform. Hope is rising like the sunrise after every storm. Wake up, Liberia. Every life got value, call their name, we call their name. Get tested, know your home. We must stand together, Liberia strong. Liberia strong. Wake up, Liberia, the nation will be whole. Transform the age response, let unity take control. Hope is beating in our hearts, the future in our hands. Together we go wake again, together we will stand. Wake up, Liberia, oh wake up, wake up, wake up, Liberia, oh wake up, wake up, wake up, Liberia, oh wake up, wake up, wake up, Liberia, oh wake up now. We wake up now, wake up. We wake up now, wake up. We wake, Liberia, wake. No more silence, no more fear. The red ribbon shining here. We wake up now, wake up now. We wake.
The theme is overcoming disruption, transforming the AIDS response. It's a powerful call to action, urging us to rethink and re-energize our efforts in the fight against HIV and AIDS. This isn't just about remembering. It's about pushing forward with innovation, compassion, and unwavering commitment. It's about adapting to new challenges, especially after the disruptions we've all faced, and ensuring that no one is left behind. Let's bring this closer to home, to Liberia. The journey here began back in 1986 when the first case of AIDS was discovered. It was a time of uncertainty and fear. Fast forward to today, and the landscape has changed dramatically, but the fight is far from over. According to the Liberia National AIDS Commission, there are now around 36,000 people living with HIV in the country. This number is a stark reminder of the ongoing reality of the epidemic. What's particularly concerning is how HIV disproportionately affects certain groups. In Liberia, women bear a heavier burden. This isn't just a statistic. It represents mothers, sisters, and daughters facing unique challenges, from social stigma to difficulties in accessing healthcare. It highlights the urgent need for responses that are not just medical, but also social and gender sensitive. We need to create an environment where women feel safe and empowered to get tested, seek treatment, and live full, healthy lives without fear of judgment. So, what does transforming the AIDS response really mean for us? It means breaking down barriers to testing and treatment. It means fighting stigma and discrimination head on through education and open conversations. It means supporting community led organizations that are on the front lines, reaching the most vulnerable people. And it means holding our leaders accountable to ensure that funding and policies are in place to support these life saving efforts. On this World AIDS Day, let's do more than just wear a red ribbon. Let's educate ourselves and others. Let's show support for people living with HIV. Let's advocate for better access to care. Every single one of us has a role to play. By working together, we can overcome the disruptions and truly transform the response to AIDS, creating a future where HIV no longer poses a threat to our communities. Thank you for listening. Let's make a difference together.
Hello, 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 hello to all our audience out there,
Can
our
you hear me?
viewers. We can hear you well. Just give me a second there, Mr. McGill. Welcome to Focus on Liberia. Welcome to Focus on Liberia. We are, of course, the most diverse network on any platform you can find. Today is World AIDS Day, and today we have decided to highlight Liberia and the global impact of AIDS, where we are, where we've come from, and hopefully where we're headed to. Today I have with me Aome and Stephen. I got it correct? Okay. They're going to be giving us a lot of information and highlighting a lot about World AIDS Day, about the impact on Liberians, the impact, the global impact, and how Liberia stands to improve from where it is and hopefully to where it's headed to. So, AML Style, you please introduce yourself to our viewers.
Hello, everybody, and thank you for having me, Mr. Padmore. And thank you, Focus on Liberia, Dennis, I sent all of you. Thank you. It's an honor to be here today. This day is very important to all of us. So thank you for the initiative. My name is Mistress Aomi Cassell Faulkner, and I live in Australia, and I'm the founder of Cultural Care Collective in Australia, an organization that combats the stigma of HIV and AIDS and promoting prevention and creating a safe and comfortable space for people living with HIV and AIDS. Thank you for having me.
All right. Thank you so much, Aome. Thank you so much. We'll go to Stephen. Stephen, can you introduce yourself to our viewers?
Hello, can you hear me?
We can hear you clearly,
Okay,
sir.
good. My name is Stephen McGill, and I'm from Liberia. I am one of those who created the first AIDS service organization in Liberia called Stop AIDS in Liberia. So, as the video portrayed it, as in 1986 was the first case, I've been around working with a lot of group, and I worked basically with nearly all of the doctors who initiated the HIV program in Liberia, volunteering as a young man, working to ensure that people get on treatment, make sure people get comprehensive treatment to care, and today life expectancy has been increased. As you correctly stated in one of those videos, it did talk about the first case in
86.
1986, but there is actually a little conversation around was it in 1985 or 1986, but we'll dive into that.
Okay, sounds good. Sounds good. Sounds good. So we let's start from the beginning. And please, I'm gonna throw it out there, and any one of you can definitely answer. For our viewers who don't know what is AIDS. Steven, you want to go? What is this AIDS thing that we're talking about?
So age is a
AIDS.
syndrome of a lot of diseases, so it all comes together with different complications. Say for example, you first of all get AIDS if you are exposed to HIV, and HIV is this virus that enter your body and break down your immune system. And there is a measurement in terms of how do they measure that quantity of HIV in your blood. So when HIV gets into your blood, it breaks down your normal body mechanism that fight against infection and diseases
Mhm.
called the CD4 cell. So when the HIV break that CD4 cell, every human being has the normal range of CD4 cell from at least from 500 up to 1,000.
Okay.
But HIV own goal is to break it down. So the world came together and coined the word AIDS to say if you have a viral load and CD4 count below 200, then you are defined as AIDS.
Okay. All right. Thank you so much for that. Thank you
So
so much.
just
If you
adding to
want to add to
that,
that, young man, yes, please.
you're just adding to that. If we just put it in simple words, is
Yeah.
um, AIDS is the breakdown of your immune system.
Okay.
So once the HIV destroy your immune system, and you acquire, because your body's empty, so it acquires anything that comes in it, it stays. It can't fight it. So at that point, you are clinically diagnosed AIDS
Okay.
patient. Yeah,
What are some of the ways that we can get AIDS? We can contract AIDS.
many ways.
Mhm.
Even if you want to go by many ways, and
Mhm.
I
Just give us a few
yeah.
common ways.
So,
Yeah.
so you got mother to child transmission.
Okay.
You got those that use those that are drug addict that use injections. So through sharp objects, through needles, syringes, um, and the bulk of it through sexual intercourse.
Okay. Okay.
So
Which I
that is
believe.
the
I mean, I'm not in depth into the drug epidemic in Liberia, but I don't believe we've elevated to needles
you
yet.
know
Yeah. So if we're speaking in Liberian context,
in that bread content, the drugs still have part to play though,
okay. Okay.
because the drugs still have part to play.
Mhm.
Because when you're a drug addict, you do anything to get your drug.
Yeah.
And sexually,
Including sex.
you go, yeah. So the drug has a huge part to
Okay.
play in
Yes.
Liberia.
Yeah.
And Stephen, you can go.
Also
Good.
remember that even though you don't have needle, but you also have other sharp instrument
Object.
and object you do use. So
Mhm.
if a man is in the rehab or in the ghetto or whatever, he using the same razor blade, the same utensil and all of that come to direct contact with blood and fluid that has the virus in it.
Yeah.
Okay. All right. Okay. Sounds good. So as you guys know, Liberia has a very, very young population. Okay. So let's talk to the young people a little bit. Let's just talk to the young people a little bit because drugs, drugs, and so what I mean, we're talking about sexual transmission, right?
Yeah.
So drugs, poverty, right? Yes. Which two things that are kind of just epidemics in Liberia we can say right now. Um, and so with that, speaking to Liberian people, to young Liberian people right now, right, who have heard about this, most of them, all of them when I born 1986, they were not around in 1986 when the whole world was shocked about AIDS, right? So for now, and then of course there was a lot of hysteria about it and stuff. So we want to give them relevant information right now. Um, what are we if we had to to talk to the young people today concerning AIDS, what information we want to give as an introduction to them?
Stevie, you want to go first, or
You go ahead.
um? If I'm speaking to my young people, the first thing I'm going to say is get informed.
Okay.
Get informed on the subject, because you cannot combat something, you cannot prevent something if you're not informed about it. And secondly, you have to join the fight against stigma,
Mhm.
because stigma is one of the main weapons against the fight of HIV. Because stigma stops everything. Stigma is in the way of every progress we're trying to make.
Okay.
So the young people should get informed. The young people should join the fight. The young people should get educated so that they can be independent and not rely on sexual favors to advance in life.
Okay.
Because the poverty is there. We know the poverty is there. So educating ourselves will rise us above poverty so that we'll be able to do things independently and not be conditioned to sexual favors.
Okay.
So, Stevie, you can take it from there.
Steven, for those who will still indulge in sexual favors, what message do you have for them?
Well, it is hard to say because we got poverty. We know it's poor, 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 poor. What I can say is sex education, educate yourself. There isn't a one size fit all,
Yeah.
but it's sex education. Even as young as 5 years old, start educating your children to know their body parts, to know the different stuff. We sometimes kind of like play it light and say, oh, they haven't reached the age yet. But a lot of things are happening right now on the internet. The children are exposed to all the different uh, uh, um, disadvantages and advantages that come to social media content or just having access to information as it is. So it's sexual education, knowing to know that once you pass puberty between the ages of 12 and 13, you actively sexual most of the time in Liberia. It, either you either being abused or in family setting, in family law, all those things that happen, is to say no to sex when you're not ready. Sex is good, it's enjoyable, but for adult and for people who are properly ready for the time to happen, because the next thing that comes to it is obligation and responsibility. It's either you have a child or you have something else. But then you know is that if you're active, you want to talk to your mother and father to be open to you about sex and use condom, protect yourself, and make sure you don't contract the disease. And
All right.
it's like
Yeah.
any other STIs apart from
Okay.
just HIV.
Awesome. Awesome. So I want to bring on Miss Wookie Cole. Wookie, can you hear us okay?
Yeah, I can hear you.
Okay. Can you do me a favor? Can you turn your phone sideways like this?
Huh?
Thank you. Can you turn your phone sideways like this? Is that possible? You probably
Okay,
have.
that means I should rotate it. Oh,
Yeah, it's
The
supposed to snap.
not the long way, but the flat way.
Yeah, just do it flat, and it should to do. Okay. So she actually went off there. We lost her for a second. Is she in Liberia?
Yeah, she's in Liberia.
Okay. All right. So
I think we're having another guy.
yeah, that's
Okay, maybe it's on. Okay, that's good.
all right. Melvin.
Welcome, Evan.
Okay, Melvin. Melvin, how are you? Could you do me a favor? Could you turn your phone sideways like that? Is he in Liberia too?
Yeah, he's in Liberia.
How did get everybody in Liberia? All right.
Yeah.
Okay. So of course there'll be internet interruptions, Liberia, but we'll continue to flow, and as they come on, we'll definitely bring them on. Okay.
Yeah.
All right. And so we got to the whole protection part. Okay. So let's talk about AIDS today. All right. AIDS today in Liberia. So first, before we go to the stigma of it and all that, can we talk about the numbers? So the Ministry of the government of Liberia came up with some numbers quite recently, which show a tick upwards. Unfortunately, it's still a downwards, which we were hoping for. A tick upwards wasn't a lot, but it's still a tick up into into the whole process at 36,000 known cases. And let me use that word, known cases.
I like that.
Yes. So we are still ticking up, right? And I want to hear from you guys here. First, if we could talk just about the numbers. What is your impression on the numbers?
Not good.
What are you thinking? What are you thinking? Do you I mean, we're a small country,
Not good.
Yeah. Yeah. And what do you think is the cause of this? Why do you think the numbers are taking upwards?
Crawford, Dr. Stephen, go, please.
So pretty much, let's look at the United Nations WHO and UNA's global team for the World AIDS Days. The World AIDS Day say we are overcoming disruption, transforming AIDS response.
Respond.
Mm-hmm.
So that tells us that we've made a lot of gains,
Yeah.
and however the gain we've made, there have been some disruption. Say, for example, in funding cuts, we've had huge funding cuts, and most of the funding cuts is depending on foreign donors. And in Liberia, we got a global fund that support our initiative. So when you talk about 36,000, it's the statistic that the government has come down and say, yeah, these are the people we have tested in every county in Liberia, and the total number of people living with HIV can be put at 36,000.
Yeah. Okay.
Uh,
Yeah, you're frozen there for a second. You okay?
Yara, okay?
Okay.
Yeah. Stephen,
All
go
right.
ahead.
Well,
Still talking?
no, you are fine. You are fine. Welcome to the show. And we are glad to have you. Can you introduce yourself for
Thank
our
you.
viewers?
I should introduce myself.
Yes, please. Please introduce yourself for our viewers.
Okay, I'm Woki, and I should introduce myself, right?
Yes, please.
Okay, I'm Woki, and from the network of PLHIV Liberia, and the network is the national network of persons living with and affected by, and we are like the umbrella for all other organizations or associations that are here in Liberia. And I don't know, I send the profile, so if you want me to just go through, I will just pick in it. And then I have done advocacy, I've been engaged in community engagement, differentiated services on HIV, and so forth. And I have been speaker for the National War AIDS Day program, and also on some international platform. So far so good.
Okay, great.
Okay.
Melvin, are you with us? Okay, I think Melvin might be having some internet difficulty. Okay,
Yeah,
Woki.
reason.
Okay, we're just talking about the challenges in Liberia concerning the AIDS in Liberia, and I was hoping you could speak to that. What are you seeing as some of the challenges that we are having in Liberia, when it comes to AIDS and the increasing numbers?
The challenges.
Yes, please. The challenges that you are seeing in Liberia, and that comes to the increase in the numbers. Yes.
Mm, well, some of the challenges I can say will be like it's mostly all about the youth information, the facts. No, because Global Fund has been one of the key donors for Liberia, and for like 4 years plus, there have been lack of awareness and things. So right now, I would say that most of them have they don't know the facts, because from what after the country the national is sent out the 36,000, and it was like an estimate. There were a lot of things on Facebook, so um they lack to know the facts. That is one something I would say, and because of they don't know the fact, I would say that they are not actually empowered, in a sense that if you know the facts, you will be able to learn more and empower yourself, and also with the early testing.
Okay. All right. Sounds good. Thank you so much. Okay. Melvin, are you there a second? Okay, Melvin is not. So I keep hearing, AMA, I keep hearing two things. One, lack of information, right? And then I keep hearing lack of funding. So can you speak a little bit to the challenges
Um,
that
yeah, those are some of the main challenges of HIV transmission in Liberia, HIV education in Liberia.
Mhm.
First of all, as we said, we got more youth than senior citizens, right?
Yeah.
And if we don't educate them to their sexual health, if we don't educate them to what HIV is, we will not be able to combat HIV. And first of all, um, having having a crowd that only information of maybe 30 years of 20 years, because most of the information people have about HIV is long time ago.
Mhm.
And the myth about HIV it's so much. And if we don't have our own funding, like the Liberian government funding the fight of HIV, we keep talking global fund cut, global fund cut. So if global fund goes, what are we going to do? So funding comes along with education. If there's no funding, there's going to be no education, and there's going to be no information for people to prevent HIV, support HIV, and progress in the fight and journey of HIV. So,
Okay. All right. Miss Stephen, Stephen, you hear the same thing. I mean, you even mentioned it. The cut in global fund, whether it's coming back, nobody really knows at this point. And that's that. It's like limited resources, and a lot of things chasing those limited resources. Um, and I mean, let's be honest here. Unfortunately, AIDS is not on the top of the list. People are looking for
no,
food. You know, people are looking for food. That's the first thing. That Maslow's law. People are looking for food before they think about AIDS. AIDS
yeah,
information.
true, true.
How do we approach it? How do we what's your take? You've been in this game for a long time when it comes to this kind of thing. How do we fund the information in the education to get it out there to these young people that we are surrounded with?
So pretty much, I want to say first of all, thank you to President Booker. I want to
Mhm.
say thank you to the National HIV/AIDS response in Liberia and all the key players and fighters. There are people on the front line, like we got the LCM, who
Mhm.
Hmm.
is the body for the coordinating mechanism for HIV in Liberia. We got giants who have already fought, and it comes back to today's yesterday. Um, yesterday attendance of the World AIDS Day program at the Parliament. So it's
Mhm.
come to political will. It's come to making domestic funding available
Great.
to buttress whatever cut or it is as locally financing. So basically, we know that yesterday was the first time they put the National AIDS Commission into the budget. So that's a good stand. We know that it's taking place. But my disappointment is that I didn't see in that march like the president. I know he had his birthday on Friday. He must have been tired. Uh, and I didn't see the
Mhm.
vice president there. I followed the program, and there are a lot of champions in Liberia who champion the HIV/AIDS. So my bold step right now, my appeal will be let it be a holistic mobilization like what we did. In the past, you have the doctors coming out to get tested in front of everybody. A big state mayor will come and get tested, like just did a day. People follow suit, and the awareness and campaign was close to heart. And every family in Liberia, there's seen one single family in Liberia will say they got somebody who got HIV or somebody who got other terminal diseases or chronic disease, apart from just HIV we're talking about. So we know that the global crisis, we got the whole world fighting right now. So money is being distributed. Let's just be real. Money is being distributed to war in Ukraine, war in other places of the world, and that money don't trickle down to our money. So we know that the global crisis in terms of funding is hard. Recent development, the United States replenished the global fund, which is very good. The United States replenished the global fund, and they be one of the first people to say, okay, we accept the global fund. They got the PEPFAR program going. They have come to have people do testing, to do PrEP, those who are negative to prevent themselves from contracting HIV and all that help way along. But another downside to it, the United States, who is the bread singer of this Global HIV Day, World AIDS Day, is also saying that okay, we don't want to support World AIDS Day any longer. We're not going to celebrate the program. So there are a lot of interest and there are a lot of for and for against. So we know what is it. Is it like HIV is like before? Is it like epidemic? Globally, it might not be of global interest, but for ourselves, well, a small population, we have the opportunity to curtail it. We have the opportunity to make sure everybody that is positive can be preventable
Undetectable.
but
Mhm.
from giving the disease to other people. And those who are negative can stay negative once they take the tablet.
Okay. All right.
Yeah.
Melvin, are you with us? Can you unmute if you can hear me? Melvin, can you hear me okay? All right.
With that cigarette outside.
Okay. All
Yes,
right.
yes.
Okay, great, great. Do me a favor, please. Can you turn your phone sideways like that? Just take it from here. Just twist it like that. There you go. And it should correct itself.
It's okay.
Yeah, it didn't correct itself for some reason. Okay, okay, just you can put
Mhm.
it back. We'll stop the program because of that. You can put it back to where it was. I just didn't, you're really small, so we can't really see. And then the light is behind you. So the light is darkening your face. The people can't even see your face right now.
You can probably turn your back to the light.
Yeah, yeah. Like turn around and face the light and stuff because the light is behind you and that shadows your face. Okay, so while Melvin works on that, yeah, there you go. Perfect,
Okay,
perfect,
there you go.
perfect. You are perfect. Okay, so while
Okay, thank you.
we talked about the we're talking today about World AIDS Day. We're talking about AIDS in Liberia. We're talking about the challenges, the strides we've made, and where do we take that? How do we take the momentum forward? We also talked about the challenges with funding and getting the information out there. So, Melvin, I want you to first, if you could just quickly introduce yourself to our guest, and then tell us a little bit about what you have observed when it comes to why the numbers are going up and what are some of the challenges you see in the Liberian community.
Okay, thank you. So, my name is Melvin Jackson, and I'm a Liberian journalist and also a CSO worker. Uh, I currently report for Spoon FM as the judicial correspondent, and once served as executive director for the Liberia Health and Rights Journalist Network, formerly of Anti-AIDS Media, and serving several media roles. Also serve as a fast checker that gave me more insight on in understanding misinformations and disinformations and how my information takes on the internet. And so with the question as to challenges faced in the fight against HIV and AIDS, I would firstly say one key challenges we are facing in Liberia for what I have seen, what I have observed, it has to do with the issue of stigma and discriminations from the public. So many a times people do not want to accept that yes, there exists the viral called HIV and AIDS, and people do go by stigmatizing one another from one point to another. uh, I have said it several times at several occasions that even at the Inferior Treatment Center where these health worker place these different treatment centers is another form of stigma and discrimination, because if you get at a place where you will have to go way at the tail end of that facility, and once you ask even as a health worker, social worker, whatever, once you ask, can you show me the treatment center, everybody attention gets at you, like uh, you are already positive, or you going for treatment, or you going for some HIV related matters, which prevent them from volunteering to go at the treatment center to either get tested or continue their treatment. And another thing, like you all are saying, it has to do with the issue of funding. So if the funding may be, we agree funding has a greater part to play, but the acceptance also matters. So the people should be willing to accept that yes, indeed, there exists HIV and AIDS, and what can we do in meeting the 95 target comes 2030. And I can simply say it that Labrador is trying. We may not be 100% as the world we expected to be, more in a society where we still have people still doubting and people still not believing that there exists the virus. So it kind of create that problem within our society, because if you do not believe, how do you accept treatment? That's one thing we all need to take into consideration, because you first have to believe before you accept treatment. And
Okay.
again, you also have to,
Okay.
you get
Okay.
me?
Yeah, I'm getting it. Just hold on one second. Stephen, and I want to speak you and AMA on this more. So we talked about the lack of funding. We talked about the lack of international funding. How does the diaspora community fit into this? Okay, how do they assist this process?
Well, for me, I can tell you for free that is, you think stigma is in Liberia alone? Stigma is even in the diaspora community worse. And I think it's about the way how we just approach life as a way and take things. But I haven't seen much done. But I know a couple of resilient, like today I watched the program in Atlanta. Some people galvanizing to great awareness within the community, like in Philadelphia, Akana, the African culture for cultural affair for immigration purposes, the health department they do a lot of work within the Liberian community. But even with that state, it's a big stigma because people know people, people talk, and people also point out other people. And on the social media, even on the social media, you see how it is that people has even come out to disclose people's status and all of that. So it is not strange. And that's something we need to hold and also make part of every Liberia investment conferences. Even you coming to invest money, let's talk about the health system too, like and get everybody involved, not just one diseases, but we know our life expectancy in Liberia is very poor because of our own behavior towards healthcare.
Yeah,
Yeah.
man. How can we do
Yeah.
that? We talk a lot. We in the diaspora would have talked plenty.
Yeah.
You know what I mean?
Yeah.
How do we assist this process?
Now, it still goes back to being educated on this subject. We got a lot of educated people in the diaspora, but are they educated on the subject? No. And what you don't know, pass you. And the funny thing is, we are all having sexual intercourse. That's the funny thing about HIV. Majority of people that contract HIV comes from intercourse, right? Majority. You got other venues, but majority of it comes from sexual intercourse. And we are all having sexual intercourse like we eat. We, we have to eat. We have to have sex. So it's a subject that we need to be educated on, because most people are one sexual intercourse away from being diagnosed or from contracting it. One sexual intercourse away from contracting it. So the diaspora needs to get educated on the subject. They need to get involved with the subject, because the stigma, and you won't believe, at the stigma that I received in Australia, it passed what I received even in other African countries.
Wow.
That's how talking about people living in Western world that have all the services to educate them. They have everything here to be in the know and to help with the fight of HIV. And yet they don't even blink an eye to know what it really is.
Wow.
So
Okay.
diaspora need to educate themselves on sexual health.
Okay. All right. What about when it comes to filling in a gap of funding? Um, funding some of these initiatives. When I was growing up, when Liberia had problem with increasing population, you know, every time you turn on the TV, there was a play, there was music, there was something that spoke to the Liberian who ain't never seen school hall before. He could understand. Why is that missing? Why is that missing today in Liberia? Where you don't see the jingles. I mean, population growth is everybody's. It's been 40 years. I still remember that in my head. You know what I mean?
Yep.
Yeah. Because somebody came up with that and said, look, let's reach to the very Liberian and hit them on that level. Why are we not seeing this when it comes to AIDS?
I think,
So
I think, I
okay,
think.
go ahead.
Okay, Wookie, you want to go? I think
Um,
it's a, go
yeah,
ahead, Wookie.
okay. No,
Go
for
ahead.
me, what I see here is that it used to happen, and we have radio talk shows, but all of those things were donor funded. So, like today in Warriors Day, um, the government, through the House, the House of Senate on Health, the House of Representative on Health, they make their commitment that with the War Aids team today, we were able to take the War Aids Day program at the Capitol building grounds. So it's like we brought it to their feet. And even though the president was not there, but I think his liaison, she was there, and everything that was said, she said she was going to take it back to him because she came around 5 o'clock this morning from Bon County. And then also the health minister was also present, and she also delivered a keynote speech on behalf of the vice president. And because today we also launched the triple elimination,
And what
which
is
is
that?
yeah, the triple elimination is that about a pregnant mother. You are being tested for HIV, for syphilis, and hepatitis B. Because according to statistics here, hepatitis B is also a silent killer, like that of cancer and other things.
Mhm.
So those representatives, including the finance minister Gafwan, also made a commitment. He even said that he was even going to take up hepatitis awareness initiative himself. So it's like they have made a commitment, because since I think since 2010 or so, um, we have not been included in the national budget. So with the domestic funding, the government have made a little, uh, uh, um, a little like 100,000 in the budget for 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 health HIV. So it's small, but we
It's a start.
continue to hold them by their feet to increase it, because 100,000 is nothing much, but compared to the past budget. HIV have not been into it. So it's something that we have been preaching on concerning domestic funding. And I see that um, the government have started that initiative. So I think even though the Warriors Day was not like as we have been seeing in the past,
Mhm.
like attendance and so forth, but I believe that by next year, Warriors Day, there's going to be a change. Liberia is going to take up her mantle and lead the HIV response in Liberia. And
Okay.
you can take up
And,
from there.
Yeah.
and
Yeah.
it's not just it's not like today's World AIDS Day. It's not just about the World AIDS Day. I got a little post somewhere on my Facebook where I said every day is World AIDS Day because whatever attacks us should be fight against every day. And one of the reasons why you say you're not saying that same response we used to have back then, let's
Mhm.
understand that we are a product of our environment. And the new
Yeah.
environment that Liberia have gotten into since 1990 is kind of different from when we grew up. So if we if we're going to attack it like we used to attack other things, the stigma needs to be challenged. If we don't challenge stigma, the fight for HIV can go to the president office, can go to all the different states, it can go to every office, every institution or administration. If we don't attack the stigma, nothing's going to happen because the stigma is the cause that people are not taking prevention, that people are not testing themselves, that people are not even having the conversation around that because people are afraid of enacting stigma and internalized stigma and whatever it is or anticipated stigma. So we have to challenge stigma in every institution, even in the healthcare system. Confidentiality should be attacked. There should be consequences if you breach confidentiality. We should have policy in place for all the acts involved in the fight of HIV before we can move forward. Or else we will still do the paperwork, still do the books, and we still set up Broad Street and say, look how people here, they got HIV, they got AIDS. We'll still do that. And people will not be able to disclose to their sexual partners to be able to do same sex. So I'm
Okay.
just saying.
All right. So Melvin, let me come to you. Let me come to you for a second there. So we keep talking about the stigma, and then I believe I heard you mention something about AIDS treatment centers, stuff like that. So one is that what you said? Are there AIDS treatment centers? One, and two is, I mean, you from the media perspective, how do you think we can fight against stigma in Liberia? Are you there, Melvin?
Yeah,
There
I'm
you go.
here. I'm here.
Okay. All right. So
Yeah.
so what
So
are there
yeah.
are there
So
centers? A treatment centers?
yeah. So you have various centers where people go to get their ART medications and other medications when it comes to HIV. And if you go at some of the facility, like I said earlier, these centers are located way at the tail end, wherein you have to burn some corners and go the other left and other right. Like most time, there's a center in West Point when I go do some report, and as soon as I ask, you see everybody be looking. So it takes the man with courage that want to continue to go to that place all of the time to gather what he wants. If you do not have listen with this entire
Hello?
It's
funny,
You
freezing.
probably
but
go ahead.
if the funny is coming,
Oh,
if the funny is coming, am I okay?
Yes, you are fine now.
yeah, you can.
So if the phone is coming, when people are not getting a rightful message, then where are we headed to? Because the thing here is, people are not getting to know that. For me, I tell people HIV is becoming more better than hepatitis B, than pressure,
Mm-hmm.
than and yeah, the pressure and other sicknesses. Because if you are HIV positive today, it won't tell you say don't eat oil, don't eat salt, don't eat this. But the other sicknesses that they have, the pressure and other diabetes, they will tell you don't eat this one, don't eat that one, get on a diet, do this. So if we just need to raise more awareness, people need to accept that yes, indeed, this thing exists, and one key issue is nobody is free or not everybody is free. So
Great.
you have to accept that. You have to accept that. Then that's the only way we'll move forward. But we can like for example, USA RD that we knew as the biggest donor just left in recent time. So all of the times they were here, why I say we do not have zero report of HIV is because why people are not accepting. Why people are not accepting is because people fear stigma and discriminations. Many we sit, in our corners and try to stigmatize people. Even health practitioner will be like, "How you manage? You got this? Can you imagine?" So if you expect to come back to you to give you further information or to come continue treatment, so because of the stigma and discriminations in the country, it is keeping people uncovered and they are not coming out to how you could have their medications. And that is causing serious problem, within the society. We understand funding is important in every aspect in the fight against HIV and helping us to meet our 95 target. But we also have to understand that people needs to accept, people needs to stop stigma and discriminations against one another, and that the only way people will feel free to open up and say, "I have this." How can we go about? Like
Melvin, can you
most of the
explain
time,
95,
you
95
it will
project? What's the 95
yes.
Uh,
project?
So
Melvin,
you
what's the
see
95,
that?
95?
the 95
Yeah. So
is the UNA target, war target for meeting up AIDS by 2030.
Okay. All right. Okay.
Yeah, but you haven't gotten the full meaning.
so
Yeah, okay.
Yes.
So can somebody elaborate on that? Melvin, can you elaborate on that a little bit? What exactly?
So,
yes. So
Melvin,
mhm.
Go ahead.
okay.
Go ahead.
Now, I just wanted to add up
Yes.
a little few points. How can we fight? How can we fight stigma? We can also
No, but
fight it through.
can we
Hold on one
define
second, Wookie.
95,
Okay, okay,
95
okay.
first for the viewers?
Okay. Yeah,
Go
Wookie,
ahead.
hold on one second.
Okay.
Steven, can you
Yeah.
get a full definition? 95 project?
So we know that there are people who are HIV positive, right?
Mhm.
We want to make sure we got 95% of those people, the viral load should be suppressed. 95% suppression, 95% on treatment, 95% in care and tear by 2030 to eliminate AIDS. Making sure that to eliminate AIDS, that your viral load is low, that it can be tested in the blood, even though you got the disease, but yeah, you be able to suppress your viral load.
Okay. All right.
So that's a global target. That's a
Now,
global target to every country in the world. So every country build that strategic plan around the reduction and the treatment and the prevention.
Okay.
Whereas now today you got PrEP, which is a medication for those who are not positive as a preventive measure to prevent you from passing on the disease. Or you have a partner who is also positive, not to infect you, but then you also take the medication to prevent your partner from becoming infected.
All right. Wookie, go ahead. Talk about the stigma.
Okay. Yeah, I was talking about how can we fight stigma to add up to what Melvin was saying. Another one that could be there is the awareness and education, like what my sister said there. And how can we do those awareness? You have to do the public campaign. Those public campaign has to do like TV, like what you were saying way back. They had that population growth is everybody problem. Having those jingles, it
Mm-hmm.
can also help. Then we have the peer-led education. That is like from the various of peer organization, including LipNet. have discussion around myth and other things and sharing personal stories. These things can also help with the stigma. Even school-based program like having school clubs,
Mm-hmm.
boys club, girls club within the school, some health club. Let's say that way, and sharing those myths and other things. It can also help. Like for me, there's a school in my community. I have every Friday to go and have those discussions with the students from seventh grade up. I have those discussions. And then another thing is strengthening the health system, like what Melvin was talking about. The healthcare workers, they need to be trained because some of them, they just don't want to wear the white clothes to be clean, neat, looking beautiful, or and always saying, oh, he or she, your uniform is sparkling. That's all they want. They usually forget about what they were taught in school. So that's another thing. And then the adolescents and the key population, friendly services is also important, like safe clinics. If we had it during the donor time, but it's something that the government can, or we as PHIV can think about. And then and my sister also talked about the policy, confidentiality policy is very important. We have it, but it's weak. It's something that we need to also think about. We will call the Steve help me out. I think the HIV law,
Model law.
the model law, the model law. But there are some clause in there that needs to be rectified
Okay.
because it's like if you are stigmatized and you take the person to court, how much the person should be fined? It's just like, for example, 1,000. 1,000 what? They say USD, they said LD, they just open. So
Look,
these are some of the things we also need to go in. And then, like thank God we have Nelson here. The media and communication strategy is another way to also help to fight stigma because if the journalists are informed and giving out those right information, it will help to reduce stigma. Community engagement and leadership, like us in leadership, we have community champions. You look at people who are open, who can discuss matters, who are not shame. You make these people as champions, telling their stories. It also helps. And then the network needs to be empowered. We also need to monitor accountability. These are things that help. Uh, these are things that can help us to fight stigma. And so when you have done all of that, the outcome that you can have from there is you have an improved uptake of the HIV testing and treatment, and then you have greater social acceptance because of the media have come about those information sharing on platforms and whatnot, and also it make a stronger community-led response to the HIV issues in Liberia. So these
Okay.
are some of the ways that we can help to fight stigma.
All right. So, yeah, man, let me come to you because statistics show us that the women and the youth still remain disproportionately affected by this disease. Okay. Um.
Now,
So how do we empower? How do we empower? I'm struggling. Let me be honest. I'm struggling with the idea of having an AIDS treatment center. And at the same time you battling stigma. Why can't you just go to your regular doctor in your regular hospital and have a private conversation with your regular doctor, and he give you the medications that you need, and you walk all like everybody else instead of putting you aside somewhere in the back where when you go in there, everybody knows exactly what you're going there for. I'm kind of struggling. I like I see the help they're trying to do, but I'm struggling
Every
with the idea. So please help me.
everywhere in the world,
Mm-hmm.
you got sexual hospitals
Mm-hmm.
because that's a different part. That's their practice,
Mm-hmm.
and that part is continuously under research.
Mm-hmm.
So literally, like people call it HIV center, but
Mm-hmm.
sexual sexual clinic. are there for a lot of other things because they are a continuous progress. So, but my point with it that he said is somewhere way in the corner. Don't do it like that. You know, you can incorporate it still in that same building, and it doesn't have to say that a place they can go. That's part of the institutionalized stigma we're talking about here. And we have to hold our people accountable. We got to put their feet to the ground. What are doctors, whatever health worker, we got to put their feet to the ground to code of conduct, to ethics. Because in a lot of institutions, like bro, we're struggling with ethics. So, and if we have ethical people working, that would not be a problem. So that is part of the fight that we're standing here today to do on this particular day, to join that fight to eliminate that putting people somewhere. You know, so and going to the question about women and young people,
Yeah.
let's say when you're youth, your sexual appetite is to the roof. And then not just that, people like young people, even people live from our generation, because I'm middle aged now, to come back to the other generation. They're in demand because they're pretty hot and tempting. So we constantly, actively, sexually active. The youth are continuously sexually active, and women are constantly, young people, women are constantly having different issues. Like the statistics in the world, women go to hospital more than men. That's why you see they're looking at the women that they're more, because women go to hospital more than men all over in the world. Because we got more reason to go to hospital. Man, when he hurting him, okay, my hair hurting, getting parasite, my dad, he stays down, he drink his beer, he's done. But a woman will faster go to the hospital to check. And our society, the people have made it patriarchy. You understand? So our women are not ready in the position to say, look, brother, you gotta wear condom. You know, brother, if you're not gonna do your test, your son not going there. Because poverty come in place. Because you need something for this person, so you can't really take your stand, you can't really take your worth. Because you're trying to please that person. So it goes right back to education and challenging stigma.
Okay, so Stephen, let me come to you now. Practical steps here. Let's talk about practical steps. How do we raise the level when it comes to this fight, you know, and this fight against AIDS, HIV, but still at the same time maintaining the dignity of those who might have acquired the disease?
Okay, so let me just answer your question, but I want to touch base on the women issue.
Absolutely.
So basically, it's about holistic awareness. You see, Samuel Kayando, when he was doing Green Revolution, he made all his ministers go and make farm, right?
Yep.
There was the political will there. So if we just come and see President Burka come tomorrow in the open public and do HIV tests, open it and let everybody see it, because he's one of the most people everybody look up to. You want to have that courage and say, who here that I know can do that? Let it be normalized. Like you're taking tests for malaria, tests for anything. When it's normalized, you will get to know the actual burden, because it has been with this holistic push with political will. Like, I've come to understand that for every major change in life, there has to be a major traumatic change in terms of either good or bad. There's something that will explode exponentially. You having World AIDS Day, at the ministers there, at the enforcement, the president birthday, you saw everybody from Liberia, all walks of life. That party was packed in our yard. And does it happen like that when it comes to HIV/AIDS? So we say within ourselves, we are even neglecting the fact that we haven't been nationalistic about it. Because in other places, they even craft laws like HIV Day. So in Liberia, my recommendation would be make World AIDS Day HIV Day. Let's everybody do HIV test and show it. Let it be public. Let it be open. No, we believe in confidentiality and all of that, but for our kind of society we're in, we need to hit it on the heart. We need to hit it on the heart. Justice came and he saw this young little Liberian girl who was HIV positive, and he supported her. In the short time, Panajala was one of the greatest speakers for HIV/AIDS, and all of the people who were dying in Blackgate, Bluegate, who were committing suicide, who were going to the pastors and throwing their medicine away, they all came back. We need more of those energy. We need most of those vibes and those synergy to bring back that drum, that human touch. That is you, it's me, your brother, your sister. There is no one family can tell me they didn't got one case or one this. They will come back to the
Mhm.
women thing. Women are
Yeah.
vulnerable in every society. We know that.
Mhm.
Even go to the village, you see how women are treated.
Mhm.
And we also know that
Very
it's
much.
not just women. No, let's just go back to the RBBSS study. So in 2013, we
Yeah.
launched this study to check behavior, sexual behavior. There are women who are also having sexual encounter with men who have sex with men,
Mhm.
Mhm.
and that's one of the leading group in every country in the world. You have laws that prevent the people from showing themselves or coming to be honest, but then you also have transgenders populations. And we have documented, the government have to report those data. They need to go back and make society better for the people and protect people based on their sexual orientation and gender identity. And
So I want to ask you a question. I want to ask a question, Steve.
Yeah.
Please, we talk about, because you're talking about the practical steps, right? And what I hear you talking about, right? So basically, and I've heard everybody kind of chiming on. One is so we talk about prevention, we talk about treatment, we talk about education, right? All right. Now, with limited resources, I don't want to put you on the spot, but with limited resources, where do we put our money?
you can put your money into treatment,
Okay. All right. And why?
into prevention.
I mean, okay, if you can't do all, where do we put our money and why?
You will put your
That's a
money
tough
into
question,
your
Stephen.
don't worry, you put your money into what the country strategic documents says because it land out where our problems are. So you
Mhm.
got if you got more people with HIV positive, you want to also curtail to them, make sure they you're doing prevention from mother to child, you're doing prevention from cross community and cross sectionalization groups
Mhm.
and say, okay, since women are the one, are there more amenities for women in terms of what happens?
Okay. Okay. Go ahead, AMA. You wanted to chime
Yeah,
in.
because
What
yeah,
do
I
you
was just saying
and here's the thing,
that
people. I don't think
that
there's one
question.
right answer. Okay,
Yeah,
but I
that's it.
want us to talk about it.
That's what I was about to say. There's no
Hmm.
one right answer because
Hmm.
you put if you put let's just say hypothetically we put
Hmm.
the our money into treatment, but what does stigma do? Stigma stops people from going to seek help the services.
Hmm.
So we will have the medication there, and nobody wants to go and take it. So it goes back to the awareness and the fight against stigma. We have to challenge stigma. When we challenge stigma, it will make people to have an open conversation about this. Because you don't hear somebody saying, "I won't go for my asthma medicine, but so I will not go for my asthma medicine." You don't hear. So when we create when the community forget that HIV is not just clinical, it's human. It's not just clinical. Those numbers are people. Those people got families. So if we learn to humanize it, and as Stephen said, I'll go with you, and I always say that all Liberians are affected by HIV, one way or the other. Your friend, your cousin, your auntie, dollar, your niece, something it has come around you somewhere. So we go back to the awareness. We got to get educated and challenge stigma, both in institutions and in our personal and family lives. That I was just saying.
Okay, Melvin, can I come to you? All right. So Melvin, yeah, I got your
Yeah.
attention. Okay. So as a media person here, as the media person here, what do you think? What do you think? What have you observed that is most effective when it comes to getting the word out there to people? What grabs people's attention the most? Did you see any? What was the response from the Liberian people when the numbers were put out there to 6,000?
So that entire number, I was one person who went back and forth, and
I know, right?
not not holistically saying that the institution was lying, but
Nah.
my point and concern have been the institution should be telling us what are the preventive measures that people can use to stop them from getting HIV, how many people on a medication and are suppressed, and what are some medications that are available that people can get on. Now, we talk about and everything, right? The issue here is people still have that normal day belief of how HIV is.
Mhm.
So I think what practical step we all need to take is to set our people down and say, hey, it's like this. If you get tested today, you do your confirmatory test. Once you are confirmed, you get on your first 1 month medications, you get on the second 1 month medications, to make it 2, you get on the third. If you consistently take your medication, you get suppressed, and when you go to your viral low, it will tell you that viral not detected. It means you're 100% free, but at least you are in a better position that you cannot easily transmit the viral from you to another person. So also, like Steven said, let's educate people that we have PrEP and we have PEP. My people, if you want to have a sexual intercourse of male or male, take this, or PrEP, or female, take this PEP. These different, let people understand that once you are consistent on your medication, your viral load, is chopped in the sense that you become part of the you equal syndrome. That is, you cannot, affect or infect another person easily. If we start to give these different measures, these different preventive measures, these different, way forward, then we try to remove that cloud that we already have about HIV. Like for example, I've heard a story of a boy who I came from the foreign ministry. He applied for a Chinese scholarship, and he was told to get at the Chinese clinic. So he went. I went at the Chinese clinic for his medical, as they normally recommend. This boy went, and normally HIV testing, you have to come to the person, make them understand that if you got this, it won't kill you. We have medications available, we have this available, and so on. But these
Mhm.
people went and just did the random testing, and this boy he was positive without telling him that he was positive. The only who held out a phone and sample all of the different stuff the test result came out with in his body. They gave it to him without explaining to him. He took that
No
result
concern.
straight to the embassy. The only God blessing was he was smart to say, let me photocopy this result, because they can see the up. So he took the stuff, he photocopy, he went and dropped the original copy at the embassy. On the way back, he received an email that he cannot go to China because he's positive.
Wow.
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 Yes.
Mm.
You saw what happened to him at that point. So why create
China
this
refusing.
situation? Why create a situation as if this is a death sentence? So many a times people treated their family members like HIV is a death sentence until we can clear out that entire doubt, clear out that entire message, and bring forth the new ones that are coming, the progress that HIV has. And you can also make some comparison. Why it's true that other sicknesses are also dangerous, but maybe people take HIV so different that as soon as you contract the virus, you off. That's how people
Mhm.
take HIV in Liberia because of the message. Imagine a miracle of man telling me that our uncle, let's say our father, medication $100 US every month for her aunt. They send it over without knowing that medication is free. And we were talking, we are going for a conference, and she was like, they think, oh, a journalist saying that. And that was how I try to educate her, saying that's not lie. And I give her, people number or the health center in Nova. I gave the phone number. She called and then her aunt now can get medication free of charge. Well, uncle or for father pay $100 US every month for medications. So we just have to continue the educations, take away the old belief that our people had because of how they saw people die and how the family members were treated, and come up with the new ones. There are new progress being made. Let me friend be sincere with this entire situation. There are
Okay.
new progress being made. You got prep, you got pep, you got suppressions that you can not easily transmit it power to another person and all that. So if we can push these different important messages, I think it will
Yeah.
help and relieve so that I can get this, I can still live, and nothing will happen to me. So why I kill myself? Because it's the
Okay.
question you have to accept. Acceptance is important in the fight against HIV.
Okay. Thank you so much, Melvin. So I want to come to a real practical point here. Wookie, I'm coming to you. What I want you to speak to a young Liberian lady between the ages of 16 and 17 who is not feeling okay and has been engaging in promiscuous sex like all young people do. Doesn't matter what gender they are. She's not feeling okay. She's hearing this message. What advice do you have to her? What are her steps that she needs to take right now?
Is it addressed to me?
Yes,
Yes.
yes.
Okay. Firstly, I would tell her the first step she needs to do is go to the nearest facility and get tested. Because usually what the youth usually like to do, they like to go over the counter. When they have headache, they just go farmer say, oh, my head is aching. After some time, that's you see that a particular illness is reoccurring too frequently, or a particular illness appears maybe every year, because like this um I would call it um the herpes.
Okay, okay, yeah,
They
herpes.
always say, oh yeah, yeah, the herpes. They will tell you, anything can happen to me every year. So I always tell you that our body always gave you symptoms. Like for me, if I'm about to get sick, I start to sneeze. Once I start to sneeze frequently, I don't know I'm going to be sick in the next few hours or the next day or so. So go get to the hospital, get tested properly. Not just maybe you go, you explain, they give you malaria tablet, this and that. Get tested properly. And once you have done your test, and because mostly they at the hospitals, at the government hospital, I don't know for the private, the counselors that are there, they are trained. You are going to be talked to, referred to wherever place you are going to be referred to. And then um, if you are tested positive, it's not the end of your life. There's life after that. For me, usually when I do my counseling, I always tell people, the day you get tested is when life begins for you.
Exactly.
If you yeah, if you are thinking of becoming a president, why president, whatsoever, and you happen to get tested today and you say, oh, okay, you are positive, it's when life begins for you. Start from there. Don't think that it is over. So with that, after those tests, get in care, stay in care, and try as much as possible to be suppressed. Because once you are suppressed, you are not going to transfer the virus easily to your partner. And for me, one thing why I see mostly that this virus is spreading is because Liberian people, I don't know in the Western world, but the Liberian people intelligently use come and say no, I like it flesh to flesh.
Human being, a human
So
being.
I think what melts,
I know,
yeah,
right?
I like it flesh to flesh. Yeah. So if you like it flesh to flesh, I think it is time now we also start to be introducing prep
Yeah,
into the conversation
yeah,
and trying to hold the government accountable that these services are there for those who are negative.
So back to
yeah.
the education piece.
Eh,
Back to the education piece. Yeah, man. I want for you to. So we, Wookie just talked about a young lady who might feel her body's off, right? But I
Mhm.
want for you to talk to one of the things we know as with, especially with our with Liberian people, right? We
Mhm.
preventive preventive medicine does not exist. Okay, if I on a conversation, if I on a telephone conversation with somebody, and I say, "Oh, I have to run," I get hospital, I get clinic appointment. They say, "Oh, what happened to you?" I said, "Nothing happened to me." But every year, I go in and I get tested. I get a checkup from a doctor. So can you speak to the Liberian people when it comes to preventing, especially when you're a young person and you are actively you are actively involved in sex. You know, you are sexually active. That's the word. When you are
Okay.
sexually active and being
Not
prevented. Mhm.
not just HIV though, but let's just say
Mhm.
generally, we need to
mhm.
do a yearly checkup, your lungs, your kidney, your liver, your general your overall health. It's something that needs to be
Blood
checked.
sugar. Yes.
Because your blood sugar, your cholesterol, your pressure, whatever it is, needs to be checked on a regular basis. Because you have a machine at the house, the generator they use in Liberia, always breaking down and carrying it to go and fix. Your car needs service. Your whatever that's in use needs to be looked after, needs to be serviced. And your body is the most magnificent machine that we're using. And it needs to be serviced and checked. So we need to be proactive with our health. Then come to talk about we got sexual transmitted diseases and infections, and we are sexually active. So I, for one, I used to do my HIV test every 8 months. That is why I knew the exact time and the exact person that I contracted HIV from, the exact month, the exact time, because I used to be proactive. And I would tell that child, you have to take accountability for your actions. If somebody tells you, I let condom more, I am safe, you should be to tell the person, do you know if I'm safe? I love condom. I let flesh the rubber. If you don't like flesh the rubber, that's your business. So we need to take action, got to be proactive in every area of our life. And going back to the education, the awareness,
Yeah.
if our young people actually know that there is something called PrEP is
What is PrEP?
PrEP is pre-exposure prophylaxis, which is
Prophylaxis.
Yeah.
prophylaxis. I said so, which is if you, let's say you're sexually active, you're in a place where you're not sure of yourself and people around you. You go to a sexual health clinic and talk to the doctor about it. You're going to get on the type of medication to prevent you just in case you come in contact, you get exposed to the virus. So that medication is going to prevent you, even if you come in contact with the virus. And then also, we got to go back to something called PEP. That's post-exposure. That was pre-PrEP. PrEP is pre-exposure, and PEP is post-exposure. So just in case did something with somebody, look, I gotta go. You immediately you go to the sexual health clinic so you can get on the medication. But that treatment, you have to go within 72 hours of contacting that virus, of being exposed to the virus.
All right. So it's
So
like,
it was,
only after.
yeah, yeah. Yeah, something like that. That money after pill kind of thing for you. Yeah, something like that. Let's just call it money after kind of thing. So you got that 72 hours to prevent you. So if we have these conversations with our people and they get educated to it, those will be us being proactive for HIV. And then also, treatment is prevention. For those of us that are living with HIV, the best thing that happens to us is treatment. But what do stigma does? Stigma stop our people from going for treatment when treatment is the solution. So if you own your treatment, effectively on your treatment for the first 6 months, you're going to become undetectable, as Steve was talking about. Now let's explain undetectable.
Yeah.
Being an undetectable HIV positive is because when you go for your test, per milliliter of blood, they count the copies of virus in it, which we call the viral load in your body. So per milliliter, if you have less than 200 copies, which sometimes you have 10, undetectable got 5, someone got 1, whatever it is, some nothing, but below 200 copies of viral in a milliliter of blood, you are clinically diagnosed undetected HIV positive. It goes to the place where they don't even see in a milliliter of blood. And when you become undetectable HIV positive, you have 0% chance of transmitting this disease to anybody. I'm married to a non-HIV positive. So I'm in a serodecoding couple relationship for the past 7 years, and he's negative still. Because I am undetectable, I got 0% chance of transmitting to him. So that's a preventative measure that I'm taking. Well, and anybody can do that in Liberia. If we keep doing that, if the young people get to know that, and those that are already positive, get in that rhythm, we will have lesser new cases. Because coming to the numbers, there are estimated numbers to 36,000, which are just documented cases, right? We're not talking about non-documented cases there. But coming to talk about, they said last year it was 34,000, and this is 36,000 estimates. That is 2,000 up. What 2,000 people on the football field? And you will see what 2,000 really is. That is huge for Liberia.
Yeah.
So all these preventative measures needs to be educated and coming to the media. The media has a part to play. The fear around HIV and AIDS today comes from the media. So, my media brother Melvin, the media is responsible for the fear that's around HIV today. So that same media, we need to use that same tool to act instead of fear, compassion instead of judgments, being proactive instead of trying to deal with it. So we need to create a comfortable and safe space, promote prevention, and challenge stigma, and challenge people breaching confidentiality in every area. So I'm just saying that to voice trust what you guys are saying.
All right, so I'm gonna come to you, Stephen. Stephen, so we've heard about, we've talked about, the young people, which we've really targeted, and the women. We've talked about men, men who are promiscuous, men who are bisexual, bringing them home to that woman, her chair in her house. We've talked about that. But one of the things I've heard is that, I've heard undetectable. I've heard PrEP. I've heard, viral load. How do we balance this where we are telling young people, safe sex, practice safe sex, but at the same time we are saying, but in case you don't practice safe sex, and you feel different in your body, go get tested. If you are positive, there's still life after you. How do we balance this where, like when we were younger growing up, right? It was a death sentence. That was made some of us scared. Today, AIDS is not a death sentence, but it's still a very serious disease. How do we balance this where we give that message that this is still serious? We want you to to take preventable measures, but for some reason, if you still contract it, there's still life for you. You can still live a normal life. To help us bring that message to our young people and the women out there, please.
So basically, it's also about how do we balance it, the messages. So in Liberia, we're very good at spreading rumors and creating sensationalization for public gain. So just in a few days from the 36,000, you went on social media, traffic was black for those who create content. So the content creator now will just find anything and put it together to get hide hawk to be monetized by Facebook, whatever the case is. But the danger at the end of the day coming back. We need to be consistent. If you do male woman business without condom and you get anything, not just HIV, even if you get gonorrhea. I know my first STI contacted was at age of 16, was a G. And I went to school, I was confused. Yeah. If you get gonorrhea, if you get chlamydia, if you get hepatitis, if you get shingles at a certain age when you're not supposed to, yes, they are, but we need to be consistent with our message and blunt. Yes, in our age time, it was harder done. The message came hard, and I guess as treatment, as prevention, make people look good, make people smell good, make people feel good, and more active like that. Then also the religious support in terms of what are the religious people putting back in our people. They got some pastor who will tell you throw your medicine away. And at the end of the day, they got some family will tell you, say, we know this sickness, they call it ring around or ring around. It's shingles and herpes around your waist. They say, oh, it's go around or belt on your waist.
Yeah.
Treated STIs give room to other common infections. We got
Infection.
infectious diseases, they got bacterial diseases. And we know that. We got
Mhm.
TB. If we got TB and got HIV and got hepatitis, trust me, the liver is going, the kidney is going. We got sugar diabetes, we don't even know. We're
Mhm.
getting blind. We are walking with big soul. Oh, the man talking finished. But then somebody called me and said there's chokoa on me. I said, you sure there's chokoa on you, but I know you to have 11 to 20 girlfriends, and you even dipping and dabbing and crossing the road. So at the end of the day, young people, be proactive, protect yourself, your future lies in your hands, and you
Mhm.
have to say no. And you have to also confide in your family and tell them, if a man coming to you or this person is bringing feed the job business to you at the group work and say, explain to somebody, talk to them and tell them.
Exactly.
Report people who rape people or people who say all kind of bad and do this for you, let them be exposed.
Yeah, I agree with you.
Okay, so to our audience out there and our viewers, you've been watching Focus on Liberia. We've been discussing today's World AIDS Day, 2025. I was just trying to do the number. That's 40 years since
Yeah.
1986. Whether you do 86, 85, you still round up to 40. Like 40 years. This has been a battle. This has been a struggle. There have been victories, there have been strides, but there continues to be challenges. We talk about our young population. We talk about the stigma that kind of exists in so many different ways. But we've been discussing here with Aomi Cassell, with Stephen McGill, with Wookie Cole, and our Jay
Melvin.
Melvin
Melvin.
Jackson.
Marvin
Yes,
Jackson.
yes. But it's been a riveting and a very high opinion conversation. As we come around to close, I want each of you, and I will start with you, Wookie, just to talk about the message today that you want to leave with our Liberian people. So and I want for us to kind of be a little focused here, right? I want for us to talk about the young people, the women, and then our people in the villages. Okay.
Mhm.
Yeah, trust me. It's not only a disease. Oh. It's not
Stephen,
certain
I was talking about that.
Yes,
Mhm.
yes, okay. And you know, so it exists in every pocket. So okay, I'm gonna start with you first. What message do you want to leave with our people today, concerning the AIDS challenges we're having, and what you are looking forward, forward to the next year? That what strides can we make coming to this next year?
Okay. Um, what I would like to leave um, is like the stronger integration of PLHIV network with the government. This is not just limited to Liberia, because from what our my sister there said, was even in the diaspora, you have stigma also is there. So when it comes to integrating networks into the government setting, like the National AIDS Commission, when they are doing budgeting, all of these things help. Um, it helps to reduce stigma, and then let us also learn to do the protection of human rights. Everyone has their rights, regardless of however he or she wants to live their life. Their rights should be respected. And then there should also be investment in the communities. When I talk about community, I'm talking about community-led initiatives. Let the
Yep.
community lead. Because sometimes what really gets to me, like even today, War is Day. It was like when it came to remark, they said 3 minutes, and I was like, today is our day. Why are you allotting 3 minutes? And then when the government comes, you give them five, even up to 10 minutes if possible. So I was like a little bit pissed today. So our initiative should be community led. Let us lead. Like last 2 years, where those were some of the words that community should lead. And so when the government should learn to invest. If you are saying that capacity is not built, you can have a TA build the capacity of the PLHIV network, so that these things can be able, um, like what we are saying, like jingles, awareness, know your HIV status. These are things that should be led by HIV champions. Because only with that, she said a word that, or was it Melvin? I think it was Melvin. I think no one is safe until everyone is safe.
Yeah,
So,
she said that.
yeah, yeah. And then another thing I always tell everybody, like, and she also made mention, every household has someone who is living with HIV. You may not know because maybe you are someone who talk a lot. They will not tell you, but we are all intertwined. So respect. Let us be able to transform. In transforming the AIDS response, let um, let the network be involved. So this is what I will say to the public. Always have us involved at the beginning, at the middle, and at the end. Because we have a say, we say, if you are not on the table, then you are where?
Yeah,
You are going
Dina.
to be in the menu. And in the menu, they are going to eat you. So that's it. Thank you.
All right. Thank you
Thank you.
so much, Wookie. Thank you so much. So, Melvin, what's your what would you like to leave with our viewers? You have people from Liberia that are watching. You have people from the U.S., from the diaspora, Australia, Europe that are watching. That are going to watch this video. As a journalist on the ground, what message do you want to leave with them concerning on what role they can play? In this process. December, it's December, right? And December in Liberia, and with the Decemberists,
December.
we are coming. And
Yeah,
yeah,
December.
we are coming. So what but at the same time, look, we want to come home, we want to enjoy home, but at the same time, we are conscious of this. So what message do you want to leave out there with the people in Liberia and then the Decemberists that are coming, and those are who will make it this year?
Yes. So the first thing I will let everyone know is that threat exists because stigma and discrimination still exists. And like I said, nobody is free unless everybody is free. We are all one with the other intertwined. So for me, I always tell people, you may be pointing at this person, but they know the status. Do you know your status? That's one thing. Because you have to know your status before you point at me and say that I will label HIV. Do you know your status? So we we have to be acceptance, because if you accept, you know the way forward. Like for me, I tell anybody I'm free. I don't joke with medication or sickness. Even I go to work, my me, I go to work cleaner, I think I do my lab. What an issue. I don't do it because why? When you say that the fact you get treatment, why will you say that it show you that before you get old, go after it? So we all have to hold together and stop the issue of stigma and discrimination. That's one key thing we have to do. And every individual know that HIV before you knew it as a death trap, but now it is no longer a death trap. You got hepatitis, you got pressure, other things that are more dangerous now than HIV is. And there was one key thing that nobody captured, or one of the commissioner ever said it. That is, 500% died with HIV. That was not reported. Because people are those that accept on a treatment are little heavier than than before. Where you hear 2% died with HIV in the side, 4% died with HIV in the side. It is not happening again. So we all have to hold together. We all have to know that once we carry on stigma and discrimination, threat will exist. Because the layman will not be free to go and tell even a big brother or man to say, Mama, I get this. They say, I get this. Because if I tell Mama, her respond, they will leave me straight to the grave. So we all can hold together. We got so many medications that once you don't want to use your condom, if you use your condom, you can also take the PrEP, the PrEP. We all need to take the different medications seriously. And we have to take the issue of condom very seriously. The same way that are coming, you can come with a condom pack. And they show that you move with it. Don't allow girls say, look at it, I will let you stay here. We think I'm going around. Nobody is free. Only everybody is free. Thank you.
Thank you so much. Thank you so much. I appreciate that, Melvin. I love how you broke that down. I love you broke that. Man.
Yeah.
So as we close, man. So you live in the diaspora, and you had the opportunity of experiencing the Liberian, the Liberian community back home, the Liberian community in diaspora. What would you want to encourage people living in the diaspora today as you close? I don't want to just put it on that, but you can be general. But please touch base on what encouragement do you want to give the people living in Liberia today who want to help, who want to be effective in this fight against AIDS, and how can they help?
Thank you. First of all, let me just say on today's being World AIDS Day, today's dedicated to awareness and commemorating those we lost in the fight. We have lost some very great people in the fight. Some of their names we don't know, but because of them, we're here today. So I want all of us to remember them today because this is their day too. So I just want to say that. And kudos to everybody that's being in the fight. Kudos to all the support from family, friends, wherever it is. But I would say first and foremost, a support team to anybody that it's like knows. or going through the journey, you need a support team. Without a support team, you can't get anywhere. Going back, people need to be educated how to support their loved ones, their friends, their family. Because if you can't support your cousin in the house, you're not going to join me in the fight. You don't know me. So you got to get educated about it, get interested about it, and start supporting those that are around you first. The gossip you heard about that boy, the gossip you heard about that man, change that gossip to a respectable conversation and use respectable words, because we change things from where we stand. We don't change things because that over there or that play happen. No, we change things from where we sit. So let's go right in our own communities, our own homes, our own family. The gossip we've been gossiping about the people that we all have heard gossip about people about that. So let's start from building a supportive community for our friends and our family. Let's start by that. And then we join the fight to say, when it comes to, I wanted to say, someone said the president should join the fight, and I agree the president should join. Not just the president. Every influential person in Liberia needs to be part of this fight. Me, because I can see all the people that can want to run for presidency or senatorial, y'all can be over here, y'all come to us too, because y'all need to be part of this fight. Because your people that y'all got do listen to you. So, example, if Judge Open we come outside today and join a fight with us, do you know how many people are going to get educated? Are going to get inspired? Or if Mr. Cummings comes, do you know how many people how you going Darius DeLon or Musability? All these people that are living in Liberia and out of Liberia, they need to be part of the fight because they got the crowd. And those that are seeing masses that they want to lead, that those masses needs to be healthy. They don't want to be a ruling bunch of sick people. They don't want that. Everybody laying in the hospital. It's not what they want. So that point too. And we should promote kindness. Instead of being judgmental, let's be compassionate. Let's understand people. The fight of HIV starts with compassion, start with understanding. We should eradicate the blame. We should break the silence. And we should get rid of the shame. There is no shame in being HIV positive. There is no shame in supporting somebody with HIV. There is no shame in joining us to combat stigma so that we can save our community and our country. Because breaking stigma will save the community. People will go for help. People will get treatment, and we will do the right thing. We'll open safer conversations. And the media, I will keep saying, you preach fear before. Yeah, they preach fear before. Let's change the measure to facts, because the facts are beautiful. There's so much progress in the HIV field and community. It's not funny. Like I'm happy being HIV positive than being a diabetic patient. There's so much things wrong with other stuff. So let's spread that message so that we can build hope. We can inspire people to not keep silent and get bitter and feel invalidated. We should value people. Stop discriminating. Stop being judgmental. Show more compassion. And no one should be left behind. Let's include everybody. And thanks for having us. Thank you
so much, AMA. I appreciate that. Stephen, I want to bring you to round it up, man. You've been in this fight from day one. You've seen it, what it was. You've seen it, what it is right now. Please talk to us. Give us just a short burst of as we close. How things have progressed. Where we stand right now. What keeps you up at night, and what you're hoping to see. Us move forward with.
First of all, I want to say thank you to all the panelists. I want to say thank you to Dennis. I want to say thank you, Mr. Padmore. Thank you to my strong, able sister, AMA. Thank you all to the government of Liberia. My appeal right now is that let's just give a minute of silence to all those our friends we lost. I've gotten thousands and thousands around the world to HIV and AIDS. Let's just give 1 minute of silence and I can close up.
Yeah.
again, I want to reassure everybody living around the world, any Liberia in the diaspora, that HIV is not a death sentence. And I want to say thank you to the government for the little effort. I want to say thank you to the commitment made today by the both houses. And I'm going to be engaging the houses as much as possible in every way forward to make sure we end AIDS by 2030. A very short story in my closing.
Mhm.
HIV brought a face of a woman in Liberia. So this woman was living in Yekapa and she was a cross-border trailer. In 1985, she got sick and she was sent back home to Zozo in Lofa County and her test got done. That was 0 case 40 years ago. Today, we are at 36,000. Can we look
Yeah.
at the amount? We don't know the number of people who have died in total and some unknownly. And we know that HIV is still real, it's still around here. Today is 40 years. That one woman. And we still see what is coming in to the messages. Women, 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 women,
Yeah.
women.
Yeah.
It's not just the face of a woman. It's a face of an unborn child. It's a face of a child who is born with HIV into the world. It's a face of a child who doesn't know how to say no. It's a face of a child who is raped in the backyard. It's a face of a child who ended being prostituted by somebody for some gain. And again, come back to, is it a man face? No, let us give HIV a human face
Yes.
and make sure that it only exists in human beings and it's part of the world, is here, and it's got to be it has to be supported with great resistance.
Yeah.
And to our government, let us fund our local funding. Even if we say that we want to do domestic funding, let's have a community led in sense of what is it the pure HIV people know and they want. Let's find some way, just how the politicians were able one day in 1970 put in flyer into the budget, let them put the network of people with HIV into their budget and say, no, this is why for HIV and AIDS, and let them encourage those who champions on the field. Community-led inclusivity and ownership will make this very progressive and it will continue to spread and we will all win. Nothing for people with AIDS who are people with AIDS. Thank you.
Yeah.
Thank you
Thank
so
you.
much. I want to thank all of you for
Thank
joining
you.
us and sticking with us. I want to thank
Thank
our
you.
viewers for sticking with us on this World AIDS Day 2025. And the theme for this year has been collective action. That's very important. Collective action is targeted and it's clear out there for everybody to see. And so as we close on this World AIDS Day, we want to encourage everybody out there, get tested. Encourage your partners to get tested. If you are tested positive, there is life after this. That medicine have made, healthcare has made huge advances. If you are negative, continue to take preventive measures.
Yeah.
It is very important. Even though you
Mm.
can live with it, you don't have to. You can live without as well.
True.
We want to encourage our young people out there. You constantly hear, the majority of Liberians living in Liberia today are young people under the age of 30.
Yeah.
That's a very dynamic group of people right there. You carry the future of Liberia and we want you to carry it healthily.
Healthily.
So with that being said, I want to thank you guys for joining us. Loki, nice meeting you. When I come to Liberia, definitely reach out. Let's connect. Let's do
Okay.
a couple of things, okay? We'll get a couple of
Okay.
things done. I promise you on that. Melvin, thank you for your eloquence. Even if that don't tell me you're generally, I want to know you generally, Chief. Yeah.
You know, the left talking plenty.
Thank you so much for your eloquence. AMA, thank you for your openness. We appreciate you very much. Steve,
Thank you.
for the fight.
Thank you too.
And carry on, and when you tire, you pass it on and we'll carry it. Okay? Yes, you have to carry
We're
it.
not getting tired. We're not getting tired with Isa.
No, that's it. That's I learned that a long time ago. When you carry something and you get a little time, you got to continue to carry by yourself. Let somebody else carry a little bit, restore yourself, and you come
Yeah.
back and rejoin. It's important.
Yeah.
Let's do it collectively.
We
With
need
that,
all of you.
yes, I want to say a good night to our audience as I continue to play this clip. You guys have a good night.
Good night. Bye bye, everybody.
Bye.
Good night. Bye.
Bye.
So what do I do now?
Everyone, today is a day that touches millions of lives across the globe. It's World AIDS Day. This year, the theme is overcoming disruption, transforming the AIDS response. It's a powerful call to action, urging us to rethink and re-energize our efforts in the fight against HIV and AIDS. This isn't just about remembering. It's about pushing forward with innovation, compassion, and unwavering commitment. It's about adapting to new challenges, especially after the disruptions we've all faced, and ensuring that no one is left behind. Let's bring this closer to home, to Liberia. The journey here began back in 1986, when the first case of AIDS was discovered. It was a time of uncertainty and fear. Fast forward to today, and the landscape has changed dramatically, but the fight is far from over. According to the Liberia National AIDS Commission, there are now around 36,000 people living with HIV in the country. This number is a stark reminder of the ongoing reality of the epidemic. What's particularly concerning is how HIV disproportionately affects certain groups. In Liberia, women bear a heavier burden. This isn't just a statistic. It represents mothers, sisters, and daughters facing unique challenges, from social stigma to difficulties in accessing healthcare. It highlights the urgent need for responses that are not just medical, but also social and gender sensitive. We need to create an environment where women feel safe and empowered to get tested, seek treatment, and live full, healthy lives without fear of judgment. So, what does transforming the AIDS response really mean for us? It means breaking down barriers to testing and treatment. It means fighting stigma and discrimination head on through education and open conversations. It means supporting community led organizations that are on the front lines, reaching the most vulnerable people. And it means holding our leaders accountable to ensure that funding and policies are in place to support these life saving efforts. On this World AIDS Day, let's do more than just wear a red ribbon. Let's educate ourselves and others. Let's show support for people living with HIV. Let's advocate for better access to care. Every single one of us has a role to play. By working together, we can overcome the disruptions and truly transform the response to AIDS, creating a future where HIV no longer poses a threat to our communities. Thank you for listening. Let's make a difference together.
And anything, the news came down, a whisper turning through our land. Hearts were shaking, fear was loud, but we stood strong, we made our vow. Now 36,000 stories live, mothers, daughters fighting still, women carrying heavy loads. Time to lift them, heal their roads. No more silence, no more shame. Call your brother, speak your name. We can end it if we stand hand in hand across the land. No more silence, no more shame. Call your brother, speak your name. We can end it if we stand hand in hand across the land. Wake up, Liberia, we stronger than before. Overcome disruption, we go open every door. Know your status, save a life. Together we transform. Hope is rising like the sunrise after every storm. Wake up, Liberia. Oh, wake up. Wake up, Liberia. Oh, wake up now. Oh, wake up, Liberia. Oh, wake up. Oh, wake up, Liberia. Oh, wake up. Use them ready for the fight. Education bring the light. Testing free, the truth must grow. Knowledge strong like river flow. Doctors, nurses on the ground. Heroes working all around. This our moment, this our time. Break the stigma, break the line. Yeah. No more whisper in the dark. We We light candles, spark by spark. Treatment work, so don't delay. Hope alive in every day. No more whisper in the dark. We light candles, spark by spark. Treatment work, so don't delay. Hope alive in every day. Wake up, Liberia. We stronger than before. Overcome disruption. We go open every door. Know your status, save a life. Together we transform. Hope is rising like the sunrise after every storm. Wake up, Liberia. Oh, wake up. Oh, wake up. Wake up, Liberia. Oh, wake up. Oh, wake up. Wake up, Liberia. Oh, wake up. Oh, wake up. Wake up, Liberia. Oh, wake up. No stigma, no shame. Every life got value, call their name. We call their name. Get tested, know your home. We must stand together, Liberia strong. Liberia strong. Wake up, Liberia, the nation will be whole. Transform the age response, let unity take control. Hope is beating in our hearts, the future in our hands. Together we go wake again, together we will stand. Wake up, Liberia, oh, ah. Oh, wake up, man. Oh, wake up, wake up, Liberia, oh, ah. Oh, wake up, man. Oh, wake up, wake up, Liberia, oh, ah. Oh, wake up, man. Oh, wake up, wake up, Liberia, oh, ah. Oh, wake up, man. We wake up now. Wake up. We wake up now. Wake up. We wake, Liberia, wake. No more silence, no more fear. The red ribbon shining here. We wake up now. Wake up more. We wake.
At Focus on Liberia, we discuss everything Liberia, from education to politics, arts and culture, entertainment, agriculture, history, religion, family, and technology. Focus on Liberia uncovers and showcases the best of Liberia and shows the world the truth about Liberia. We educate, elevate, and promote all things Liberia. We conduct interviews, panel discussions, debates, and more. Tune in to Focus on Liberia on Facebook and YouTube and be a part of the stories that make up the news.
This is Focus on Liberia, and I am Dennis Jah.